Good Tuesday morning and welcome inside the 977 The Bolt Studios. My name is Nathan Blackwell and we're here for yet another edition of the Your Care Our Mission radio show presented by the Humboldt County Memorial Hospital. I have with me Jacob Miller from Pain Management at the hospital. He's the new doctor in town. He's a big time pain guy.
Nurse anesthetist.
Yeah, there you go. And Jacob has been in Humboldt for a couple of months now. Jacob, how have things been going?
Things have been going well at the pain clinic. Hopefully I've been able to give some people of Humboldt some relief from their pain. Referrals are coming in nice, and then hopefully the providers in the area are starting to use me a little bit more for their pain services, as well as words getting out to the patients and people in Humboldt about what I'm doing.
Now when it comes to your office or expertise, what exactly does that all entail?
So mostly when a typical patient, when they come to me, whether they're referred from a physician's office or they just call and make an appointment themselves, which is totally doable, I'll have them come in, do an assessment on them, kind of evaluate where their pain's at, and determine a care plan for them at that point. My main goal with most of my patients is to just increase them functionally, get you out there, get you doing what you enjoyed doing in the past, maybe things that the pain's been keeping you down from. So first, I want to improve you functionally, and then try to alleviate your pain as best as I can. Chronic pain is something that's been going on for a while, and you're not going to fix it with one treatment. So hopefully, you come in, do an assessment, develop a plan that might include some medications, might include some interventions such as injections. We have a great physical therapy department at the hospital. Mm-hmm. I send a lot of patients to physical therapy. That's what it consists of.
Now, say I'm a patient, I have lower back pain. What do I have to do to see you, and what are the steps that I would have to follow?
You can just call up to the hospital directly and call to the surgery department at 332-7669 and go ahead and just make an appointment. Just say you would like to see me, you're having some pain, and you'd like me to check you out and see what we can come up with as far as a treatment plan.
As far as on your end, what are the more common treatment plans? I mean, do people look for medications? Do they look for physical therapy? Do they look for injections? So far, you've been here about 2 months. What has been, I guess, the biggest avenue for you as far as pain management in this community?
Most people like to have injections because they like to see results immediately. Mm-hmm. Long-term, injections in combination with physical therapy or physical therapy with just medications can get you a long ways as far as decreasing inflammation and just getting you back on your feet. And a lot of times it'll resolve without any interventions such as injections. So That's what I like to start with first. It doesn't work for everybody. It just depends mostly on your lifestyle and how effective the treatment might be as far as getting you back on your feet.
And then looking into the pain management, as far as on the body, where do people come to you and say pain is most of the time? I mean, is there a problem spot that occurs at X age, or is there something that you've noticed, any trends as far as pain is concerned on the body itself?
Unfortunately, gravity is not very kind to us. So the majority of people that come in, they come in with lower back pain. A lot of people with hip pain, and I would say other than lower back, it's mostly neck pain. Mm-hmm. Just from whether it be bad posture, sitting in a computer, on a phone all the time.
Right.
Upper neck pain would probably be the second most common.
Interesting. And with you as well, you're dealing with some stuff with corporate health as well. Can you explain that a little bit?
Yeah. The hospital there has a really good corporate health program branching out into the business side of Humboldt, and we see patients. Well, I guess there wouldn't be patients. They kind of are patients, but workers that come in from the surrounding area and treat their work comp injuries or do pre-screening physicals and drug screening, all that kind of stuff as well.
Awesome. Well, good information, Jacob. Appreciate you coming in here this morning. And we will take a break. We'll come back and discuss with Deb Skeeters about some events coming up. Jacob, nice job.
Yep. Thanks.
All right. After this message, Deb's coming up on the Your Care Mission radio show.
What comes to mind when you see February on the calendar? Maybe chocolate candy hearts, red bouquets of flowers, or homemade heart-shaped valentines? At Humboldt County Memorial Hospital, we take matters of the heart seriously all year round. Heart disease is still the leading cause of death for men and women. To prevent heart disease and increase awareness of its effects, HCMH is proudly participating in American Heart Month. Prevention and control of risk factors is key. At HCMH, we provide a wide variety of services to help you prevent, diagnose, and control heart disease. From having your cholesterol checked in our friendly laboratory to an echocardiogram of your heart done in our skilled radiology department, an EKG performed in our efficient emergency room, an appointment with your cardiologist in our bustling outpatient clinic, a blood pressure check with the resourceful girls at Public Health, a meeting with our expert dietitian, or enrollment in our cardiac rehab after a heart event with our compassionate cardiopulmonary staff. At HCMH, we provide a full spectrum of quality heart care right here in Humboldt. From the bottom of all of our hearts here at Humboldt County Memorial Hospital, we wish you a happy and healthy Heart Month.
Welcome back inside the 977 The Bolt Studios. Nathan Bleckel for another edition of the Your Care Mission radio show. We talked to Jacob Miller before the break. Now we're going to be joined by Deb Skeeters. Deb, good morning. How are you?
I'm fine. How are you?
Oh, I'm fantastic. A couple of events coming up for the hospital. The LifeServe blood drive is coming up, Deb.
Yes, that will be Friday, March 2nd, 12 to 4 p.m. in the conference room there at the hospital. You can schedule your appointment online or call the hospital directly, and walk-ins are also welcome.
Awesome. So once again, Friday, March 2nd, 12 to 4 at the hospital.
Correct.
So that's always a unique event. And then coming up as well, the heart and stroke check.
Yes, that will be Monday, March 26th. That is also offered by the hospital and
Right.
Unity Point Clinic. It's to call and make your appointment. You call Trinity Health Partners at 515-574-6505.
Awesome. Monday, March 26th for the heart and stroke check. And that will be Friday, March 2nd for the blood drive. So always a lot going on at the hospital. And Deb giving us the lowdown on all of that. Thanks a lot for coming in, Deb,
Yeah,
and
thank you.
and Jacob as well did a great job. So that wraps up another edition of the Your Care Mission radio show. You can listen back to it online if you need be. Otherwise, enjoy the rest of your week. And this has been the Your Care Mission radio show presented by the Humboldt County Memorial Hospital. Good morning.